Good morning, I'm Elena Romensis, Anna Garcia's doctor.
And I'm Jordan Seip, the pathologist examining Anna Garcia's death.
Today, we're going to lay out the map of Anna's medical history and her autopsy reports to conclude a cause of death.
The emergency call came in at 9:45 a.m. The police and the EMT arrived at the scene at 9:56 a.m. Anna Garcia, a 38-year-old woman, was found dead, lying face down in her entry hall in a pool of blood. It was a comfortable 73 degrees Fahrenheit inside of Anna's house, despite it being 92 degrees Fahrenheit outside. She was last seen alive the night before her former husband, Alex Garcia. Investigators are trying to piece together what happened between the time that she was last seen alive and when she was found dead at the crime scene. After a few experimental trials, it was concluded that the unknown pills by Anna's right hand were acetylsalicylic acid, also known as aspirin.
The substances found in her vomit were crackers, yogurt, and tortilla chips, which is a lot of carbohydrates.
The unknown spilled substance to Anna's left was found to be orange juice.
Nothing was concluded about the blood spatter found on the stool and the pool of blood coming from her head.
The unknown fingerprint was Alex Garcia's, Anna Garcia's ex-husband.
The unknown strands of hair was determined to be Anna Garcia's.
We were unable to run tests on the empty syringe, but we are assuming that it was insulin.
And the unknown shoe print was determined to be Anna Garcia's.
After the body was taken from the scene, I started doing an autopsy report on Anna Garcia. Within the first autopsy report, these were my findings. For her prelim blood results, there was no evidence of alcohol, and there were trace amounts of acetylsalicylic acid, and no evidence of overdose or non-prescription or prescription drugs. With her general appearance, it was a well-developed, well-nourished Hispanic female who appears to be her stated age of 38. Her body height is 64 inches, and her body weight was 165 pounds. No evidence of post-mortem tapering is present, and rigor mortis is generalized. With her clothing and valuables, she was admitted fully clothed in a body bag, and one ring was present on her right ring finger. Clothes are not torn but stained with blood, and a small amount of vomit is present on the shoulder area of her blouse. With her head and neck, it was normally shaped and she had medium-length hair. There is an injury to the right temple, including an open wound where the pre-mortem bruising is evident. Neck shows no signs of injury. With her trunk, the chest and torso are appropriate size, no visible signs of trauma, and the abdomen is distended. With her extremities, they are all symmetrical and without abnormalities. The ankles were slightly swollen and showed signs of edema, are positive with moderate fluid accumulation. The fingernails showed substantial graying, indicative of low oxygen. The right proximal humerus showed signs of recently healed break, and does the left distal tibia. And there was also an inflamed red injection site on the thigh. With her injuries, there was a head wound to the right temple 2 centimeters in length and 5 millimeters in depth at the center. Surrounding area was bruised, limited bleeding evident though. No skull fracture. The right elbow was bruised, 2 centimeters in diameter, limit contusion. After that, there were no other visible signs of injuries. So the general report was she had an oxygen deprivation, fingernails and toenails were blue-gray color, evidence of vomit and oral cavity, blunt trauma to the head wound indicated a fall against a solid object, light bleeding suggested lack of blood flow, and finally she had edema in her ankles.
So going through all of her medical history documents, these are some key points that I figured out here. So she was diagnosed with sickle cell anemia when she was younger. When she was 14, she was diagnosed with type 1 diabetes, and she was also figuring out more complications with her heart at the age of 37 until she was diagnosed with the stuff listed above: sickle cell anemia, type 1 diabetes, heart disease, and a urinary tract infection.
For the basic toxicology reports, there was no evidence of alcohol in her blood and no evidence of non-prescription or overdose of prescription drugs. The blood glucose level was 280 milligrams over deciliters, which in the normal range is 70 to 125. Stomach contents. There was no evidence of toxins or poisons, and there was 125 milliliters of partially digested food present. With her internal examination, her esophagus was said to be intact and gray pink without lesions or injuries, and the stomach is intact without injury. And the stomach contents were found to be tortilla chips, crackers, and yogurt. Next, I took a urine sample, and again, there was no evidence of non-prescription or overdose on prescription drugs. There was a significant amount of protein in her urine, and there were a lot of ketones in her urine too. With the internal examination, the lens of the right eye appeared cloudy. Blood vessels in both eyes are very swollen. Abnormal blood vessels are present in the left retina. Vision was most likely compromised. With her trunk, the left kidney appears very pale and shows beginning signs of necrosis. Right kidney appeared to be perfectly normal. With another external examination, the nails on her fingers were blue-gray in color, which is signs of lack of oxygen. With her blood, there were trace amounts of hydroxyurea, which are used to treat sickle cell anemia. With one of the final tests on her blood, once again, there was no evidence of alcohol. Evidence of stains equivalent to 40 milligrams. I wrote a note that said she had a prescription bottle for Vasotec, an ACE inhibitor, which was found at the scene. Although there was no evidence of this drug in blood, the decedent was most likely had not taken the medication for at least 3 to 4 days. The blood glucose level was once again 280 milligrams over deciliters, and the normal range is 70 to 120 milligrams per deciliter. With another external examination, an X-ray image was obtained of the heart and lungs before the internal examination. Lungs should appear normal with no infiltrates. We did a very detailed examination with her cardiovascular system. It revealed that she had concentric left ventricular hypertrophy. There's also evidence of a mild mitral valve prolapse. This means that the mitral valve does not close properly. A stent is present in the left anterior descending coronary artery. However, scar tissue and clots partially block or occlude the lumen of the vessel. The right coronary artery is 80% occluded. Narrowing is also noted in the renal arteries as well as the cerebral arteries and provide evidence of atherosclerosis. Evidence of mild peripheral vascular disease in the left.
On the night of August 12th, the night prior of Anna's death, it states in her food diary that she had eaten 1 cup of vanilla ice cream, half a cup of mini marshmallows, and 5 Oreo cookies. For a type 1 diabetic, that is very unhealthy. After eating too many carbohydrates, insulin will rush into your system, but since she is type 1 diabetic, she would need to inject insulin. Due to the amount of carbohydrates she consumed the night before, it caused her blood sugar levels to spike at night, then drop extremely in the morning.
This would all explain why she had a cup of orange juice and assuming an empty insulin syringe by her side at the crime scene. And one of the autopsy reports, it stated that she had a UTI and was prescribed antibiotics, which can make your blood sugar spike. This can explain why her blood sugar was 280 milligrams over deciliters in the autopsy report. In another autopsy report, it showed that her left kidney was very pale and showing signs of necrosis, which is the death of bodily tissue.
Anna also had heart disease and she was tachycardic. In a medical history document, it is stated that she had a slight heart murmur detected. She had a prescription bottle for Vasotec, which is to just help with her high cholesterol. She also had an ACE inhibitor, which is a type of treatment to help with high blood pressure. An ACE inhibitor decreases oxygen flow to the heart, but at the same time lowers your blood sugar.
It has been concluded that the cause of death was a heart attack leading straight into cardiac arrest, with complications of hyperglycemia, which can lead to cardiovascular disease and kidney damage.
With history of early heart attacks in the family and also having her coronary arteries severely blocked and necrosis in her left kidney along with a UTI. This is how we concluded her cause of death.